Now let's talk about PSM subject, which is a bigger subject. Okay? Now ophthalmology is not done, it will be done. Don't worry. Okay? Chalo. Let's start with this subject now, PSM. Sir, stage 1, 2, 3, 4 and 5 stages. What are these stages? What happens to the birth rate? What happens to the death rate is again a exam ka question. Sir, stage 1 is high stationary. Then sir, stage 4 is low stationary. 5th is declining. And in this early expanding, late expanding is there. So in high stationary, my dear friends, everything is high. In high stationary, everything is high. Already explained. Everything is high. Now early expanding mein, birth rate is high, but death rate start decline. Late expanding mein, the birth rate is start decline and death rate is slow decline. Low stationary mein, everything is slow decline. Declining phase mein slow decline and very low decline. In all of these, India is in stage. This is India. Late expanding. India is in late expanding. Stage 3. Yes, India is in late expanding. Done, sir? So remember, high stationary mein everything is high. Then high, start decline, slow decline, then slow decline and very low decline. So these are the stages, 5 stages you have to remember. They make the pyramids. Now what is demographic dividend and demographic liability? Demographic dividend and bonus or gift is what? When younger population is more in a country, when independent population is more in a country, that is called as dividend or gift. Now demographic liability is more people are dependent. Who are more people? Less than 15 years and more than 60 years. Old age are more, 60 years retirement की age होती है. So more than 60 years and less than 15 years, these are the people who are the dependent people. If in a country these people are more, they are called as demographic liability. Now fertility indicator, 4 formulas I'm going to teach right now, and these formulas are equally important for the exam. What is GFR? GFR stands for general fertility rate. How you are going to calculate? Each is corrected to other one. Sir, what is this GFR? It is a total number of children born to a female in a reproductive age group. Now, what is reproductive age group? 14 to 49 years. Okay. Now, this is reproductive age group, my dear friends. Remember how we have to calculate total number of live birth upon woman in reproductive age multiplied by 1000. Total number of live birth upon woman in reproductive age multiplied by 1000. This is going to be the GFR. Total number of live birth, woman in reproductive age multiplied by 1000. One formula clear. Now next is TFR, total fertility ratio. Now here what is TFR? Number of children born to a female in a reproductive age group with age specific fertility rate. इस age group में इतना, इस age group में इतना, इस age group में इतना. For that again the formula is same. Total number of live birth upon woman in reproductive age plus age specific fertility rate multiplied by 1000. So GFR and TFR, both the formulas are clear to all of you. GFR के अंदर only the reproductive age group, reproductive के साथ age specific reproductive age group, then it will become TFR. Now coming to the next is gross reproduction rate. Gross reproduction rate. This is GRR, gross reproduction rate. Now daughter born, number of daughter born to a female in a reproductive age with ASFR, that is age specific fertility rate. Now your denominator will be daughter born upon woman in reproductive age plus age specific fertility rate into 1000. This is called as GRR, girl. NRR, this is net reproductive rate. My dear friends, daughter born upon WRA, that is woman in reproductive age specific fertility rate and age specific mortality rate multiplied by 1000. This is going to be the net reproductive rate. And this is best to evaluate National Family Planning Program. Now, I'll ask you question and you tell me what I'm talking about. Okay? girl born upon woman in reproductive age plus age specific fertility rate multiplied by 1000 is a formula for gross reproduction rate. Okay, if I add this here, age specific mortality rate, ASMR also, then this formula will become of a net reproductive rate. Very good. Number of live birth upon woman in reproductive age multiplied by 1000. Now this formula will be off. बस एक आंसर दे दीजिए, then we are good to go for the next topic, sir. That is contraception. GFR. Very, very nice. So all the formulas are clear to all of you. Now let's talk about the contraception. Contraception, sir, we are dividing into two forms. One is temporary, another is permanent. Temporary and permanent. Temporary and permanent. Temporary method include natural method. Natural method में calendar method, cervical mucosa thickening you have to check, है ना? Lactational amenorrheas, then cycle beads, etc. Barrier method, condom, OCPs, IUCDs, injectables, DMPA जिसके अंदर आता है. Permanent में tubectomy and vasectomy. Tubectomy is done in female, vasectomy is done in male, sir. So let's in detail learn about all these things. First of all, natural method. We have a calendar method. In calendar, we'll mark it the dates in which we don't have to do the unprotected sex. If body temperature is increasing before the ovulation, we have to stop the unprotected sexual intercourse. If cervical mucosa is thinning, that means fertile window is going on, then also we have to stop the unprotected intercourse. Then lactational amenorrheas. Lactational amenorrhea ke andar should like action should be like lactational amenorrhea ke andar we cannot do. Okay, sorry, lactational amenorrhea ke andar we can do it. Okay, chaliye. Cycle beads, also known as 𝗲𝗏 method, where the mala is there and in the mala there are the dates. You will have to let's start with what we have left with. Generation we were talking about the copper T, that is T shape, U shape, 380 and 375. Which is better, sir? 380 is better than 375. Why it is better? Because of the half-life, which is 10 years in the 380, sir. 10 years, which is 380, sir. Done. Now, generational IUCDs, we are having the hormonal one. Two, we are having Mirena and progesterone. Equally important for the exam. Sir, Mirena is having lowest failure rate, better, and half-life is also better, 5 to 7 years. And what drug it is secreting? That is what, sir, your levonorgestrel, LNG. How much? Daily at the rate 20 mcg. Equally important, sir. Progesterone, natural progesterone is coming at the rate 65 mcg per day, but the half-life is less and the failure rate is more as compared to the Mirena. So is better in Mirena and progesterone. Remember, progesterone, your answer is Mirena is better. Mirena is better, sir. Mirena is better, sir. Now the mode of IUCDs, what they are doing actually? They are increasing the cervical mucosa thickness, which is preventing the fertilization. Absolute contraindication is PID. When the person is having a disease diagnosed PID, in that, remember, it is absolutely contraindication. Then ectopic pregnancy is a side effect of a third generation IUCD. Third generation IUCD. And what was third generation? Hormonal IUCD. Now we are having OCPs also for the contraception, Mala and Mala D. What salt they are having inside? Remember, it is ethinyl estriol and your levonorgestrel. The estrol and in short you can say estrogen and levonorgestrel is there. 21 hormonal tablet and 7 iron tablets are there, sir. Injectable mein we are having DMPA, that is depot medroxyprogesterone acetate. Half-life is approximately 3 months it will work. Dose is 150 IM we are giving it. Contraceptive of choice. These are some one-liner question you should remember for your exam. My dear friends, yes, unmarried but sexually active, condom plus OCPs. Just married, OCPs. After delivery of first child, the gapping is there, then IUCD is the first method. First method, my dear friends. Now, sir, let's talk about this population covered by the healthcare system. Small thing. Subcenter. See, in this chart, just remember, the population cover in a plain area is more than the hilly areas. That's the first fundamental. So sub center, if in a plain is covering more 5,000, in hilly it cover only 3,000. And beds are 0 to 3 bed depending on type A, type B, where delivery is happening and not happening, and how much deliveries are happening. If no delivery happening, 0 bed. If deliveries are happening, 0 to 3 bed depending on that, sir. Let's start with the population covered by a healthcare system. So in the plain area and the hilly area, you will understand the plain area will cover more population as compared to the hilly areas, and then we'll talk about the number of beds they are having in the particular center. So number one, we have to start with the sub center, where in the plain area population covered is 5,000, and the hilly areas the population covered is 3,000, and number of bed is 0 to 3 depends on type A and type B, where delivery is happening and where delivery is not happening, my dear friends. Then coming to the primary healthcare system, PHC, primary healthcare center, where there is plain area 30,000 and hilly area 20,000 population is there, and the bed cover is 4 to 6 bed. CHC, community health center, in the plain area 1,20,000, hilly areas 80,000, and beds are more than 30. In the district hospital, it covers no population norm, but the beds are more than 100 bed. Beds are more than 100 bed. It depends, sir. Now coming on to the next one, ASHA. Once the examiner asks about the full form of ASHA also, accredited social health activists. How much it is currently right now? 1:1,000 population. Only female can become a ASHA, and married female with no more than 2 children. Age is between 20 to 45, and she should at least be 10th pass. Now promote family planning, breastfeeding, immunization. That is a work of a ASHA. She'll be involved in all these kind of programs where she'll be doing the house job. She'll be going house to house and promote the awareness program, and also give some drugs also if needed to the required people. Now multi-purpose worker committee, it was given by Kartar Singh committee, and one multi-purpose worker is on 5,000 population. The multi-purpose worker is male or female? My dear friends, male is for the malaria service, surveillance, spray insecticide, water quality in the village, and female is for antenatal care, postnatal care, conducting of the normal delivery. She'll be helping in family planning, immunization. Now coming to the epidemiological triad and triangle, what difference it is having? Epidemiological triad is having agent, host and environment. Agent, host and environment. If we compare this with the epidemiological triangle, it will be having agent, host, environment as compared to the time also, as well as time is also included. Now let's talk about malaria. Diagnosis is by peripheral blood smear. Which species are there? Vivax, falciparum, Malaria and ovale. This falciparum is most common in India, and remember, for the Vivax and malaria we have to remember the drugs. For the Vivax and falciparum, tab, chloroquine and primaquine we give, sir. For the falciparum, now we check a non-pregnant female and a pregnant female. This treatment is different from a female and a non-female. In a northeast and north other states, the treatment is different. In a northeast state, the treatment is ACTAL. Lumefantrine is added to this. In other state, it is ACTSP. Now, if it is a pregnant female, what in the first trimester you can give? You can give only the quinine, but in the second and third trimester, you will again check if it is northeast state or other state. In the other state, you will give ACTSP. In the northeast, again, you will use the ACTAL wala combo. ACTAL wala combo, sir. Now, coming on to the vectors and the disease, my dear friends. Now, along with me, you all have to answer in the chat box. Along with me, sir. Yes, right here. Sandfly, the mnemonic is COSO. Sandfly is a vector for a disease like K for Kala Azar, O for Oriental Sore, Sandfly fever, Oraya fever, Se, sleeping sickness, Sote, black fly, Onchocerciasis. Soft is cute, Q for Q fever. Hard tick, ऐसे कासानूर फॉरेस्ट डिजीज, एंटिक टाइफस. माइट खुजली करता है, स्क्रब टाइफस, एंड आर फॉर रैट, रिकेटेशियल. लाउस इज एपिडेमिक टाइफस, रैट फ्लीज, एंडेमिक चूहा अंदर रहता है जमीन के, एंडेमिक टाइफस, एंड ऑल्सो लीड टू बुबोनिक प्लॉक्स. रेडविड बग will lead to Chagas disease, and itch mite will lead to scabies. These are some important vectors and disease they are causing. Now let's come on to this table. This table is going to give us 100% exam question. 3 mosquitoes I'm going to talk about. Number one is Anopheles, Culex and Aedes. My dear friends, Anopheles is for the malaria. It will lead to malaria. And Anopheles lives in clean water. Anopheles eggs are boat-shaped and their angle to the ground, you will see, is elevated angle like this, 45. This is Anopheles, lead to malaria. Now culex, filariasis, Japanese encephalitis, and your West Nile fever. They breed in the dirty water. Japanese encephalitis history you have heard of, paddy rice worker where stagnant water was there. From there the mosquito came, bitten, and the person diagnosed with Japanese encephalitis. So stagnant water is for the culex, and the eggs are C for culex. C are small clusters, and they are yellow shaped mosquito, yellow colored mosquitoes. Then Aedes mosquito, sir. Aedes mosquito breeds in artificial collected rainwater. Single cigar shaped eggs are there, and the disease they are causing is, सर ज़ायकेदार, Z फॉर ज़ायकेदार येलो चिकन. कहाँ खाया? रिफ्ट वैली में बैठ के. और क्या बीमारी हो गई? डेंगू. दिस इज अ निमोनिक टू रिमेंबर दिस. ज़ायकेदार येलो चिकन we have eaten in the Rift Valley, and the disease we got is dengue. So all these diseases are associated with the Aedes mosquito. Aedes mosquito, Aedes mosquito. Now coming on to the dengue testing, Kala-Azar testing. These are some important tests you have to remember for your exam. Now coming on to the number one is dengue. The test is NS1 antigen test. Clinically also we can check. We will put a tourniquet. If more than 10 petechiae per square inch is there, then the dengue positive. Lab diagnosis, hematocrit more than 20%. If PCB volume is more than 20%, then also we'll be thinking of a dengue. But sure diagnosis will come after NS1 antigen test. NS1 antigen test. Now dengue's feature are bone breaking fever, body ache. Any specific treatment for a dengue? My answer is no. Then what you can give? Supportive treatment, and also there is one tablet you can add to that, that is carry pill. Now coming to the Kala-Azar, next one, sir. Diagnosis is serological test RK39. Field surveillance. If we are going on to the field and we don't have a lab, we can do the aldehyde test. If we have to do the confirmatory test in the lab, we are having RK39 test. Treatment is injection liposomal amphotericin B, and if orally you have to give, you can give the miltefosine drug, sir. Miltefosine drug. Japanese encephalitis, how you can diagnose it? RT-PCR. Clinical feature is encephalitis plus minus convulsions will be there, plus amplification host is big once asked in the exam, and it is seen where? In the stagnant water paddy fields we were talking about. Japanese encephalitis is a fatal disease, but we can give a vaccine to a person, and the vaccine given here is a live vaccine, and the name of vaccine is 𝗓𝗏1414-2. 𝗓𝗏1414-2. Now filariasis, my dear friends. The last is filariasis. Filariasis is caused by Wuchereria bancrofti, peripheral blood smear pe. You are going to see the maximum activity between 10 o'clock to 2 o'clock, and treatment of choice is 𝗖𝗵𝗵𝗴𝗍. Epidemiology. Who is the father of epidemiology? John Snow. Father of public health? Cholera. Germ theory was given by Louis Pasteur, and first vaccine was given by Edward Jenner. Now what is this incident and what is this prevalence? Number of new cases in the population is called as incidence, and new plus old cases is called as prevalence. So though the dono ka definition is clear to all of you. Now my dear friends, maternal mortality ratio. First of all, we'll talk about the ratio, and ratio is number of maternal death upon live birth into 1 lakh. Same way rate is there, and only difference it in the rate, it is multiplied by 1000. In the ratio, maternal mortality ratio, it is multiplied by 1 lakh, and in the rate it is multiplied by 1000. In the rate it is multiplied by 1000. Now different type of studies we have to focus on right here, sir. Cross-sectional study, it gives us prevalence. Prevalence, that means old and new cases. This is kind of a snapshot study, cheaper study. At the same time only you can compare the exposure and outcome of a disease in the same time, which is a short study, snapshot study, and this is to check the burden of the disease. This is to check the burden of the disease, my dear friends. Now next is a case control study. It gives you odds ratio. It is a study of a rare disease. Now case control study is a backward study. That is why it is called as retrospective study. Case control study is a backward study. Like in the COVID we did, sir. In the COVID we did, sir. Rare disease COVID we did, sir. Cohort study, prospective study, forward study, it will give us the attributable risk, relative risk. It is a study of rare risk factor. Cohort study is a forward study, sir. We will observe the particular set of population, what rare risk factor they are having and what kind of outcome is coming. The forward study is cohort study, backward study is case control study. If you are comparing the disease and the outcome at the same time on the base of previous data, that is going to be the cross-sectional study. If you are comparing the population, whole population, like of one state with another state, of one country with another country, those kind of studies are called as ecological studies. Those kind of studies are called as what, sir? Your ecological studies. Now errors, random error can be sampling, systemic error can be bias. How to treat this bias? We will do a blinding, single blinding, double blinding and triple blinding. What type of bias we are having? Observer can be biased, interviewer can be biased. Recall Parkinsonian bias. It is a bias happening on the base of hospital data. Bias happening on the base of hospital data. Then treatment of bias, if we talk about single blinding, double blinding and triple blinding. Single blinding, only subject is blind. Double blinding is subject and object. That means patient and doctor both are blind. Triple blinding, patient, doctor and observer, or you can say analyzer, they all three are blind. All three are blind. So this is a treatment blinder. Now coming to the confounding error based on exposure and outcome. इस चीज का exposure था और outcome क्या निकली? Those are called as confounding error. Those are called as confounding error. रिस्क फैक्टर किस चीज का था? बीमारी कुछ और ही निकली. अब स्मोकर के अंदर कोई तीसरी बीमारी निकल आई. This is called as confounding error. How to if confounder is known, we will do the matching process. If confounder is unknown, we will choose a particular group. We can do the randomization, random group, or we can choose some small group and we can randomly choose from that. So we were talking about the mother and child health. So infant mortality rate, you will see the number of infant death upon live birth into 1000. These are some important formulas you will find in a slide. Only 7-8 formulas you have to remember for your exam. Now under 5 mortality rate, is under 5 mortality upon live birth into 1000. It is the best indicator for overall development of a country. A country's development is defined by the death of a children. If you have to talk about any country's healthcare system, you will check how many children are dying less than 5 years of age. Less than 5 years of age. So if the country is having less number of mortality rate in that age group, that means healthcare system is very good and country is a developed country. Now RMNCHA program, where reproductive mother neonate child health care is taken care. In this antenatal care, the minimum visits are 4 and maximum are 8. This is again a previous year question of the exam. Postnatal care is also coming in this, where the different type of medications, etc. support is given to a female. Now supplementation which is given in under this program is iron folic acid, my dear friends. Iron folic acid. 6th month pregnancy and 6th month lactation, we give iron folic acid. How much iron, sir? This is important. 60 milligram of iron and 500 microgram of folic acid is given. 60 milligram of iron and 500 milligram of folic acid is given. How much calcium is given? It is 500 milligram. And albendazole is only given in a pregnant female in a second trimester. ठीक है सर? मैक्स तो 12 है ना? नहीं यार, मैक्स 8 है according to WHO, but in India it is 12. Oh, sorry. According to WHO it is 12, but in India we take 8 visits only. Okay, chali. Other schemes are like Anemia Mukt Bharat, iron and folic acid given under this. Janani Suraksha Yojana, incentive for institutional delivery is given to both mother and Asha who is accompanying them. Then coming to the Janani Shishu Suraksha Karyakram. This program promotes about the WHO का जो है वो 13 visit है. India में only 8 visits are taken. Yes, India में less visits are there. ठीक है? जननी शिशु सुरक्षा कार्यक्रम, increase government facility utilization, free OPD, IPD, drugs, diet, sick or newborn, pregnant female की care के लिए this program was there. Then home-based newborn care. Who does this? Asha. How many visits? If it is a home-based delivery, 7 visits are there. If home visit is there, if home delivery is there, 7 visits are there. If hospital delivery is there, 6 visits are there. What is the function? Function is to promote breastfeeding, growth and development, develop the immunization. चलो, राष्ट्रीय बाल स्वास्थ्य कार्यक्रम, beneficiary are 10 to 19 years age children. प्रधानमंत्री वंदना योजना, मातृ वंदना योजना, it is मातृ वंदना योजना, where incentive is given for the delivery and immunization to the mother. Suman, सुरक्षित मातृत्व आश्वासन, no one can deny the pregnant female. So here even the private facilities can't deny the female patient for the delivery or any kind of health checkup. They can't deny. This is coming under Suman scheme. 𝗲𝗲𝗵𝗿 is the quality of labor room. To increase the quality of a labor room, separate initiative has taken place and that is called as 𝗲𝗲𝗵𝗿. First referral unit, if you have to talk about, sir, PHC to CHC is the first referral unit and second referral unit is district hospital. All the operations are possible district hospital level onwards. Okay, all the operations are possible because anesthesiologists, then your surgeons, they are all available district hospital onwards. Now immunization scheme is there. This is again changing again and again multiple time, which I will not be touching right now. Okay. Now cold chain, let's talk about. What is this cold chain? Important topic for your exams, sir. Cold chain, if we talk about, sir, cold chain, the temperature is 2 to 8 degrees Celsius. 2 to 8 degrees Celsius. There is a ice line refrigerator. This you can see ice ray. Work without electricity for 8 hours. Work without electricity for 8 hours. 8 hours. 8 hours. Plus present at PHC and CHC. Vaccines stored here are MR, BCG, polio, PV. These kind of vaccines are stored there in this ice line refrigerator. Then some small boxes are there. They are day carrier, which are present in sub-center. How much vaccine they can carry? Approximately 30 vaccines they can carry. Now next coming vaccine while monitor. Sir, vaccine while monitor. Now there in the vaccine while monitoring, you will check if the central square is fader than the periphery. Yes, vaccine is good to use. If same color as periphery or darker than periphery, then you cannot use it. Then coming to the open vial policy. Open vial policy, the vaccine can be stored in peripheral center after opening vaccine till 28 days, except MR, rotavirus, BCG, Japanese encephalitis and COVID-19. And best example I can tell you about the COVID-19. When we were going to the center, after opening, they were only opening the vaccine when there were the group of 10 people. Because if they will open and it is not usable in the other person, then they have to discard that without using. So for that purpose, they open vial policy need to be taken care of. ये तभी खोली जाए जब उतने लोग वहाँ हो उस वैक्सीन को लेने के लिए. Now some important strains of vaccine you have to remember. BCG, BC, who is BC? Danish. So remember BCG is Danish 1331. Then coming to the measles. मजा आया है गुड़ खाके. गुड़ को क्या बोलते हैं? जैगरी. एडमिनस्ट्रॉन जैगरी. रूबेला, बेला का एड्रेस क्या है? RA27/3. मम्मी जहरीली, जेरिलिन. चिकन पॉक्स, चिकन कैसा बना? ओके, ओका स्ट्रेन. येलो फीवर 17D. Then OPV, साबिन, live, that is live in मतलब live. ठीक है? Oral polio vaccine. So these are the important strain you have to remember for the exam. Then coming to the TB elimination program, the WHO has a target of 2030, but India set a target of 2025, which is not achieved. ठीक है? But new guidelines will come about the target also. But you have to remember what you are giving right here: 2-month HRZD regime, 4-month HRE, isoniazid, rifampicin, है ना? These drugs are given. Money given for a TB patient for a nutrition is 500 rupees. 500 rupees per month during the treatment. Now coming to the next one is National AIDS Control Program. Here we check the 90-90 strategy. What is this 90-90 strategy? 90-90 strategy says 90% should be diagnosed, 90% should be on a treatment, and 90% should be on a surveillance. And this is having a red color ribbon. This is Treatment to this is antiretroviral therapy. Different therapies given to this patient. 𝗲𝗲 clinic logo has been asked once, my dear friends, and different type of kits also we have to remember. Kit 1 is grey color, that is for urethral discharge, that is cervicitis. Kit 2 is green color, that is for vaginitis. Kit 3 is white color, genital ulcer. Kit 4 is blue color, then again genital ulcer. This is non-herpetic genital ulcer, and this red color kit, red color kit is, red color kit is for herpetic genital ulcer. Herpetic genital ulcer. Yellow is for lower abdominal pain. Yellow is for lower abdominal pain. Lower abdominal pain, and black is for scrotal swelling or inguinal buboes. Scrotal swelling or inguinal buboes. Inguinal buboes. Chalo. Now coming to the next one, sir. National Leprosy Eradication Program. Paucibacillary, multibacillary leprosy is there. Less than 5 if lesions are there. This is paucibacillary. More than 6 is multibacillary. Treatment for pauci goes for 6 months. Treatment for multi goes for 12 months. And what treatment we are giving? RCD in both of them. Both of them RCD. R for rifampicin, D for dapsone, C for clofazamine. Clofazamine. For both of them we give RCD regime, sir. Both of them. Then this is a logo of a leprosy eradication program. Then polio surveillance program. In this we are giving P1 and P3 bivalent, not trivalent. Also, which type of paralysis you will see? Flaccid paralysis. 2 stool samples are given. One is within 28 hours and another is within 14 days. And this is sent to a lab with the help of reverse cold chain, and temperature is -2 to 8 degrees Celsius. Then coming to the all live vaccines are contraindicated in pregnancy, except your answer is yellow fever. Now next chapter what we have to start right now is nutrition energy requirement. Now there are workers like sedentary worker, moderate worker and heavy worker. Sedentary worker, moderate worker and heavy worker, if we talk about, male and female ratios are different. Male and female ratios are different. Sedentary worker, in the female it is 1600 and male it is 21. Moderate worker 21, 27, heavy worker 27, 48. So female is like a 16 in the 16, 21, 27. Male is 21, 27, 34. So additional energy requirement, how much it is required? In pregnancy it is 350. If a female is lactating, my dear friends, less than 6 months is 600 and more than 6 months is 520. Can you calculate how much energy is required to a moderate worker male, who is moderate worker male? Can you tell me energy requirement? And also energy requirement in the heavy worker female, who is 3 months pregnant. Both the calculation, please write it down in your chat box. Now vitamin A we have talked about yesterday's session also. Source is halibut fish liver oil. If vegetable source is there, carrot, less than 6 months 50,000 international, 6 to 1 lakh, more than, and if weight is less than 8 kg, we again give 1 lakh international. 1 lakh international, 1 lakh. Very good, nice answers given. 2700 for the moderate worker, and for the female who is heavy worker, the answer is going to be 27 plus 350. Female who is heavy worker, 27 plus 3 month pregnant, 350. It is going to be 3050. Okay, chali. Now let's talk about the next thing, and that is your iron. Normal pregnancy and lactation में कितना चाहिए? 30, 40, 20. Calcium is normally 1000, pregnancy 1000, lactation is 1200. Folic acid 200, 500, 300. Iodine is 160, 250, 280. Okay. Now coming on to the diseases, toxin and the food stuff, important one. Chaliye, let's move on to this topic one by one. Sir, here you remember letharism. कहता है कैसे, how to remember this? The toxin is 𝗶𝗶 and the disease is affected, it will affect the knees. So you just remember name of disease, toxin and the food stuff. 3 things you have to remember. Chalo. Now remember 𝗲𝗲𝗹𝗼. Toxin is 𝗲𝗲𝗴𝗿𝗺 and food stuff is केसरी दाल अरहर की दाल. 𝗲𝗲𝗹 में sir the toxin is 𝗲𝗲𝗴𝗺 and food stuff is केसरी दाल अरहर की दाल. केसरी दाल अरहर की दाल. ठीक है, तो कैसे याद करना है? लठ लेके बोने गया केसरी दाल अरहर. एंडेमिक एसाइटिस, टॉक्सिन इज प्यारी, अंदर आओ प्यारी, मिलते हैं. प्यारी इज पायरोलिजिडिन एंड मिलते हैं इस मिलेट सीड. एपिडेमिक, आप संग संग आओ मस्ती करते. संग संग इज सैंगुरिन, टॉक्सिन, फूड स्टफ इज मस्टर्ड ऑयल. देन एर्गोटिज्म, एर्गोट एल्केलॉइड एंड बाजरा. अफ्लाटॉक्सिन and it is present in groundnut. Now I'll ask you question, please write it down. Sir, 𝗲𝗲𝗹𝗼, 𝗲𝗲𝗴𝗺, very good. Sir, epidemic droplets, epidemic, आप संग संग आओ. What toxin I'm talking about? आप संग संग आओ. What toxin I'm talking about? Sanguarine, very good. Aflatoxicosis, which food is causing this? Aflatoxicosis, which food is causing this? Aflatoxicosis, groundnut. Very good. Groundnut, very good. Now coming to the next chapter, that is environment. Environment mein number 1 thing we have to talk about the air. The most important indicator of air pollution is who? These days 100% exam question is going to come because air pollution is becoming the prominent topic these days. So my dear friends, most important indicator of air pollution is sulfur dioxide. Number 1 MCQ. Air quality index less than 50 is good and more than 400 is very bad. So your paper is going to be made from Delhi. Delhi is having very poor AQI. So remember environment chapter se question aane wala hai. Now next is kata thermometer. It will be measuring what's low air velocity and cooling power of the air. Hygrometer, H for H, humidity. Soiling index, air pollution check करेगा. Kyoto protocol, decrease ग्रीन हाउस इफेक्ट के ऊपर एक टोक्यो के अंदर कॉन्फ्रेंस हुई थी जिसमें ग्रीन हाउस गैसेस को कम करने के लिए काम किया गया था. नाउ लेट्स टॉक अबाउट द नाउ नॉइस. up to 85 decibel it is considered normal, but these days 90 decibels in the factory workers etc. for 5 days in a week for maximum 8 hours in a day. More than 120, 110 temporary, 160 will be permanent hearing loss where hair cells are getting damage in this. Water quality, to check the water, the best thing is color, temperature, odor etc. And best disinfectant, boiling is better answer than chlorination. Sir, क्लोरीन डिमांड कैसे कैलकुलेट करोगे? एक apparatus होता है, that is again your exam का question is Horrocks apparatus. And there will be free chlorine level. How you are going to check? With the help of chloroscope. Free chlorine level are checked with the help of chloroscope, and sir, chlorine demand is checked with the help of Horrocks apparatus. My dear friends, next is orthotoluidine test and OTA. Orthotoluidine is free plus combined chlorine again. OTA, orthotoluidine arsenite test, free plus residual chlorine. It will give total, it will give, free give, and residual also it is going to give. Now how much fluoride should be there in our drinking water? 1 ppm. If it is exceeding, then it is a problem. It will lead to the skeletal sclerosis, and if it is decreasing more or less, it will lead to the dental caries. Sir. Housing standard, floor space per person should be 750 to 1000 square feet. Cubic space should be more than 500. Door and window area should be 40% of the floor space, whatever we are having, sir. Now radiation is also important topic from where the question has been asked in the previous exams. Thickness of a lead apron is more than 0.5 mm. Total natural radiation is 0.1 rad per year we are receiving, and max permissible in case of a normal man and woman is in a year is 5 rad, but if pregnant female is there, 0.5 rad a year only it is allowed, sir. Sewage की बात करेंगे. The liquid waste with the human excreta is called as a sewage, where 90 9% water is there, 1% content is there. Strength of sewage is calculated with the help of, sir, biological oxygen demand is better answer than the chemical oxygen demand. Now the level of prevention is also your exam question. Primordial, primary, secondary and tertiary, sir. Primordial, primary, secondary. Now you see the risk factor and the disease, sir. Sir, if risk factor is absent and disease is also absent and still you are taking the precaution, for example, every day you are waking up and doing yoga, exercise, etc. This is called as primordial prevention. This is called as primordial prevention. Then, sir, if risk factor is there and disease is absent and still you are taking the precaution, for example, wearing condom, getting the vaccination done. Secondary, risk factor bhi hai, disease bhi hai, then you are doing the screening, S for S, that is screening of the disease, sir. Screening of the disease. Tertiary, now risk factor and disease both are present and damage has occurred. Now after major surgery, how the life is going to, for example, after heart transplant, after implant. So these are the levels of preventions we are having, right, starting from primordial. जब कुछ नहीं था, सुबह दौड़ने जाते हो, एक्सरसाइज करते हो, तब क्या है, प्राइमरी में क्या है, रिस्क फैक्टर है बट डिजीज नहीं हुआ है, यानी कि हमें जैसे कोविड आया था तो हमने वैक्सीन कब ली थी, व्हेन वी वर एपरेंटली वेल, वी वर नॉट इन्फेक्टेड. ऐसा नहीं कोविड पॉजिटिव पेशेंट को वैक्सीन लगा रहे थे, नो, व्हेन वी वर ओके देन ओनली वी वर टेकिंग द वैक्सीन. नाउ सम स्क्रीनिंग ऑफ चॉइस वी हैव टू थिंक ऑफ, सर. The screening of choice, cancer cervix, it is going to be the pap smear, better answer than your viability test. Then breast cancer, clinical examination is the best thing, self breast examination. Colon cancer में fecal occult blood test, we'll check the stool samples. Diabetes mellitus, fasting blood sugar is better screening test than your HbA1c. Otherwise, most best confirmatory is HbA1c only. Thyroid में thyroid stimulating hormone test we do. Now coming to next important things like lead time. Lead time. What is lead time? So the time between a first possible diagnosis and appearance of a symptom. First possible diagnosis and appearance of a symptom. पहली बार diagnose कब हुआ, symptom कब आया, उसके बीच का जो time है, that is called as lead time. What is sensitivity, specificity? One liner you have to remember for your exam. Sensitivity tells about the diseased population and specificity will tell you about the healthy population. बीमारी वाली चीज को कौन बताएगा, sensitivity, और ठीक वाली चीज को बताएगा specificity. That sensitivity, the true positive upon true positive plus false negative, and specificity is true negative upon true negative plus false negative. Positive predictive value, disease is present, test is positive, disease is absent, test is absent, that is negative predictive value, negative predictive value. So in this everything will be true, true positive, false positive, new, and in this true negative, false negative. So this is how you have to remember these four formulas also, sir. Now biostats. Sir, quantitative versus qualitative, we have to do that. Quantitative versus qualitative, my dear friends. Quantitative data are measurable and they are continuous like height, weight, age. 1, 2, 3, 4 ऐसा नहीं आज एज जो है 25 साल है कल 30 हो जाएगी, ऐसा नहीं है, एक कंटिन्यू चलते हैं, ठीक है. क्वांटिटेटिव इज काउंटेबल डाटा, 1, 2, 10 भी हो सकते हैं. डिस्क्रीट डाटा, जेंडर है लाइक 10 मेल 10 फीमेल, 10 गरीब 10 अमीर, लाइक दिस इट विल गो ऑन. मीन मीडियन मोड क्या है, सम ऑफ ऑल नंबर डिवाइडेड बाय एन नंबर, वी ऑल नो, बचपन से कर रहे हैं. मीडियन क्या है, सेंटर मोस्ट वैल्यू. मोड क्या है, मोस्ट फ्रीक्वेंट वैल्यू. नाउ नॉर्मल डिस्ट्रीब्यूशन कर्व, दिस इज आल्सो कॉल्ड एज Gaussian's curve. What Gaussian's curve is telling us, area under the curve, which is giving us the standard deviation, and standard deviation is also your previous exam ka question. Sir, 1 standard deviation is 1 MCQ 68%, 2 standard deviation is 95%, and 3 standard deviation is equal to 99%. 99%. Now here we are having right skewed curve, or which is also called as positive skewed curve, positive shift. Left skewed curve, which is also called as left shift. My dear friends, there is right skewed curve is mean, then median, then mode. और इसका उल्टा कर दो, which will be left skewed curve, which will be your negative shift, that is your mode, median, mean. Normally we say mean, median, mode. If mean median mode is there, this is a right skewed curve or a positive shift. If it is mode median then mean, it is going to be the negative shift, which is also called as left skewed curve, which is also called as left skewed curve, left skewed curves. Thank you so much. Normal curve, mean भी बराबर होगा median के और mode के. Done, done, done. Now the type of graph we are having, sir. The quality वाला याद कर लो, quantity अपने आप याद होगी. Sir, there is a picture. There is a picture. In this picture, there is a map. In this map, there is a bar, and in this bar, someone is eating pie. So pictogram, spot, map, bar, and pie. Rest everyone will come in the quantity representation. Now test of significance, my dear friends. Test of significance. First of all, 1 group, 2 group, and 3 group. What will do for 1 group? For 1 group, if 1 group is there, for example, you have to remember like this. If only 1 group is there, there will be a more bonding. So remember, this is paired t-test, which is done for the quantity. 2 groups are there. अगर 2 group हो जाएंगे तो लड़ाई लग जाएगी. Unpaired t-test, sir. And if 3 or more group is there, we need a Innova car to make them sit. Big group, big car. Innova test, sir. Innova test, sir. And for quality, we are having Chinese product. Quality is tested, तो 𝗖𝗵𝗶 test, sir. वेस्ट मैनेजमेंट के अंदर सीधा आप बायोमेडिकल वेस्ट की बात करेंगे. विच डस्टबिन इज थ्रोइंग, व्हाट वी हैव टू थ्रो इन दैट. सर येलो एंड रेड फर्स्ट वी हैव टू कंपेयर. येलो एंड रेड बोथ आर infectious. Now yellow is non-recyclable and red is R for red, R for recyclable. If any infectious waste we can recycle, that will go into red color. If any infectious waste which we cannot recycle, that will go into the yellow color. For example, anatomical waste, vaccine, if we cannot recycle it, it will go into the yellow. Gloves, blood bag without blood, it will go into red color. Blood bag with blood, it will go into the yellow color, sir. Yellow color, sir. Needle, syringe, etc. white color. Blue color में implant, broken glasses, it will go into the blue color. This is a basic things you have to know for the. Now ESI, employee state insurance scheme, which is giving a leave. In this, only one leave is very important, enhanced sickness leave. For tubectomy, it is giving for 14 days to female for 100% wages, and in vasectomy, it is giving to male for 7 days with the 100% wages, with the 100% wages, sir. Now what is this icebergs phenomena? Iceberg phenomena is like this. The submerged part are the hidden cases or the subclinical cases whose sign symptoms are बीमारी है but sign and symptoms are not there. Now what are diseases which are not following this iceberg ka phenomena? My dear friends, remember this is MTR, that is your measles, tetanus, rubella. Measles, tetanus, rubella, and even some books are saying rabies also. Rabies also. What is 𝗲𝗵𝗵𝗿? So Delhi is disability adjusted, best indicator of burden of disease. कितनी लाइफ आपने बर्डन, बीमारी के बर्डन में जी है, उसके क्वालिटी एडजस्टेड लाइफ ईयर. लाइफ आफ्टर ट्रीटमेंट, लाइफ आफ्टर ट्रीटमेंट. ट्रीटमेंट के बाद कितना, लेट सपोज 60 साल में कोई बीमारी लगी, बोले खत्म ही हो जाओगे, ऑपरेशन नहीं कराओगे, तो ऑपरेशन के बाद अगर आपने 10 साल जिंदगी और जी ली, दैट इज कॉल्ड एज क्वाली. हेल्थ एडजस्टेड लाइफ एक्सपेक्टेंसी, नंबर ऑफ ईयर्स स्पेंड इन गुड हेल्थ, बेस्ट इंडिकेटर फॉर असेसमेंट ऑफ हेल्थ स्टेटस ऑफ अ कम्युनिटी. तो डाली इज अ बर्डन, कितनी देर बीमार रहे, डाली में बीमार रहे. क्वाली मतलब बीमारी के इलाज के बाद कितना जी पाए, और हेल के अंदर कितनी देर आप स्वस्थ रहे. डाली में बीमार रहे, क्वाली के अंदर आप कितना ट्रीटमेंट के बाद आगे जी पाए. दोज आर द थिंग्स यू हैव टू रिमेंबर. नाउ इंक्यूबेशन, टाइम बिटवीन एंट्री ऑफ ऑर्गेनिज्म एंड फर्स्ट साइन एंड सिम्टम. नाउ टेल मी, फर्स्ट साइन एंड सिम्टम और डायग्नोस के बीच के टाइम को क्या बोलते हैं? व्हाट वी कॉल द टाइम बिटवीन फर्स्ट साइन एंड सिम्टम एंड डायग्नोसिस, व्हाट दैट इंटरवल इज कॉल्ड एज लीड टाइम. लीड टाइम इज अ करेक्ट आंसर गिवन बाय. वेरी वेरी गुड सर. जनरेशन टाइम क्या है? एंट्री अंदर हुई और कितनी देर में वो मैक्सिमम कम्युनिकेबल हो, कितनी देर में वो मल्टीप्लाई हुआ सर, दैट इज जनरेशन टाइम. क्वारंटाइन इज डन फॉर डिजीज्ड पर्सन और apparently healthy person. तो क्वारंटाइन आपको किया गया हर जगह जाने पे, आप बीमार थे इसीलिए करा कि आप बीमारी फैला सकते हो, इसीलिए क्वारंटाइन इसीलिए किया गया ताकि उतने दिन आपको वहां रखा जा सके कि अगर आपके अंदर वो बीमारी हो भी तो वो उतना उसका टाइम पीरियड खत्म हो जाए तो आगे फैल ना पाए। अगर आप बीमार हो, इफ यू आर डिजीज पर्सन यू विल बी आइसोलेटेड, इफ यू आर apparently healthy then you have to go for the quarantine. In India we have to go for yellow fever for 6 days and COVID-19 for 14 days. COVID-19 for 14 days. इंडेक्स केस क्या होता है? प्राइमरी केस जो नजर में आया, बट एक्चुअली बीमारी कौन लेके आया? जो हेल्थ अथॉरिटी से पकड़ा, दैट इज योर प्राइमरी केस. सेकेंडरी इज प्राइमरी से आगे जो हुआ वो सेकेंडरी केस हुआ. नेशनल प्रोग्राम फॉर कंट्रोल ऑफ ब्लाइंडनेस एंड विजुअल इम्पेयरमेंट का लोगो इज इम्पॉर्टेंट. हाउ मच पॉपुलेशन वन ऑप्थेमोलॉजिस्ट इज कैरी, दैट इज इम्पॉर्टेंट. Less than 3/60 blindness is there with the best possible correction is the WHO का definition for the blindness, sir. Sir, now public quality life index and human development index, what is the difference between these two? These are having ILL, infant mortality rate, life expectancy at 1 year and literacy rate. In human developmental index we are having life expectancy at birth, expected schooling years and income per capita. So these are the two things you have to remember कि अगर लाइफ एक्सपेक्टेंसी बर्थ की बात हो रही तो वी आर टॉकिंग अबाउट HDI. इफ लाइफ एक्सपेक्टेंसी एट 1 year they are talking about the PQLI. Per capita income is a part of HDI. Infant mortality rate is a part of PQLI, sir. Niti Aayog given the different committees. What different committees they have given? Kartar Singh committee, which was a multi-purpose worker committee. Chaddha committee, basic health worker committee. Mukherjee is family planning, 𝗘𝗵𝗵𝗿𝗺 medical education, Bajaj is for the finance. Now health communication, sir, didactic approach is one way approach. सिर्फ मैं बोल रहा हूँ और आप आगे से feedback नहीं दे रहे हो, that is didactic. If I am saying something, you are also giving me feedback, that is soriatic. Individual को how will approach? Letter, SMS. Group method is what, sir? Your group discussion. 6 to 12 people, if they are discussing, it's group discussion. If series of lecturer or experts are coming, they are giving lecture and going, that is called as symposia. And if 12 people are sitting around, they are discussing something and audience is watching, like we have a news channel debate, that is called as panel discussion. That is called as what, sir? Your panel discussion. And mass communication method is radio, social media, etc. Now disaster management, who will go first to the site of disaster? First is paramedical staff, and this is being taken care by Ministry of Home Affairs. What are the pre-disaster and post-disaster phases? My dear friends, pre-disaster phases and post-disaster phases are equally important. Prevention, first we can prevent it or not. Mitigate, we can go to some other place. Preparedness, we will try to see if the flood is coming, we'll try to make the boundary walls, etc. Like this, the prevention, mitigation, preparedness. Now disaster has happened. What other things are there? Response, recovery and rehabilitation. Response, recovery and rehabilitation, sir. Now most common disease after this is gastric enteritis, and most common micronutrient deficiency, that is going to be vitamin A, sir. Now these are some logos you have to remember. Integrated Child Development Services, Ayushman Bharat, where 5 lakh cover is given to per family. One family is given 5 lakh rupees health insurance. PM Poshan Yojana, this is replaced by midday meal scheme. Other important things are WHO, where the WHO center is, headquarter is, the WHO headquarter is where, sir? Can you tell me? It is in the Geneva, Switzerland. UNICEF का अपना न्यूयॉर्क सिटी में है. वर्ल्ड बैंक की भी अपना वॉशिंगटन के अंदर है. बायोहजार्ड का लोगो, दिस इज ब्यूरो ऑफ इंडियन स्टैंडर्ड लोगो, once asked in 2020 August exam. Then these are some colorful structures, no need to tell what it is, it is obvious to all of you what it is. चलिए, एक डॉक्टर कितने पे है? At current we are having 1000 population. Okay, some recent data has came about 1.7 something like that, but till now in gross factor, if we have to remember that, we remember one doctor is on 1000 population currently. ASHA is 1:1000, 3 nurses पे एक doctor है, 1 pharmacist is on 10,000 population. Now ORS, what ORS is having as also your exam question. My dear friends, ORS की बात करेंगे. First thing is sodium, potassium citrate, chloride and your glucose. your sodium and glucose is same, 75 millimole per liter. Potassium is like a केला 20 रुपए किलो 20 mm. Citrate is like a santra orange, it is 10 rupees kg, so 10 mm. Chloride is left 665. ORS is a fluid of choice for mild to moderate diarrhea. Mild to, how we are giving? 1 sachet we are mixing in 1 liter water. WHO has advised like that, sir. Now bioterrorism group A, B and C, and then we are going to finish this PSM. All important topic we have covered. Group A is having sub-TB pneumonic. Sub-TB stands for smallpox, anthrax, botulism, tularemia, viral hemorrhagic fever. These are coming under Group A bioterrorism. Group B is 𝗃𝗵𝗵, that is fever, Q fever, brucellosis and epidemic. And Group C is 𝗵𝗵 𝗃𝗃. You can actually, these are bioterrorism. Why these called bioterrorism? Because of this we can attack other country. किसी और country को बीमार कर दो तो गोले बारूद के अलावा भी लड़ी जा सकती है. That is going to be because of the bioterrorism. किसी कंट्री के सोचो पानी की पाइप में कुछ मिला दिया आपने तो पूरी कंट्री को इन्फेक्शन हो जाएगा. Those are the bioterrorism agents we have studied, and successfully we have completed our second subject.